All right, I'm ready when you are.
All right, I'm ready.
Okay, so we went ahead and got the suction machine and the canister. I've plugged it into the wall. It has to be plugged in, and we also got all the tubing. So one tube will connect it from the canister to the machine, to the suction machine, and one tubing will be what you use for your oral care. This tubing and the canister is changed weekly or as needed, but every time you use it, you need to make sure you have a little cup of water so that you can suction the water up and kind of clear the tubing out. So in order to do this, I take the blue thing that says, looks like halyard, kind of looks like that. I'm going to plug it in to this tubing, connect it right there. In order to do that, this tubing initially had like a little plastic piece in it. I pulled it out, connected it. I'm going to turn it on. It's going to make a really loud racket. You want to make sure that these caps and things are closed so that it has good suction. So I'm going to turn on. Let's see. So this blue piece has an on and an off button, and you can hear a difference. When I do on, I can literally hear it sucking. I've already connected the end of the toothbrush to it, which comes in these 24-hour kits. So we'll test it in the water. I'm going to flip it to on, dip it down in the water, and you immediately see that it starts going into the machine. So we're working. We're doing good. All right, this is our patient, which is also my grad student. Her name is Lorene, but Lorene is going to pretend to be my nonverbal patient that I'm going to be performing oral care on. So literally what I'm going to do, position her up all the way. I've got my gloves on. I've got this turned to off right now. I'm going to grab this solution that comes in the 24-hour kit, open it up. I'm just going to dip my toothbrush that's still off into it. Kind of dab it off so it's not dripping. I'm going to take the toothbrush and I'm going to go into her mouth and I'm going to turn the suction on while I'm doing it. So I'm brushing. The friction of the toothbrush is really ideal. That's what we want. That's what's going to clean her mouth. And I'm using the suction. It's kind of like when you go to the dentist, it's automatically pulling up any secretions and anything that's going to be coming through. So I'm not creating any extra saliva or anything because I'm sucking it up. All right, so we're done with that. I did a thorough job top and bottom. I'm going to